education. I talked some about my personal life and the difficulties that continued in my first marriage, about starting psychoanalysis and what my experience of that treatment modality was like for me. And I talked about some of my professors and some of the interesting and good things that I was learning while I was a student. I left out a whole area, though, that I would like to touch on because it's going to be an area I return to over and over again. I don't recall that I said much about my early experiences with clients who had been assigned to me for one thing or another. So I want to talk about some of the clients I saw while I was in graduate school because some of my experiences with them were quite memorable. In the first and second years of graduate study, I was assigned to the House of Medicine. I went to the Detroit Veterans Administration Hospital in the first year, and my practicum experience was to learn intelligence testing and to administer intelligence tests to veterans. In my second year, I moved to the Ann Arbor Veterans Administration, and now the curriculum had become more sophisticated, and I was studying all forms of personality testing, both projective personality tests like the Rorschach and the TAT, and objective personality tests like the MMPI and others. And again, in the VA, my assignment was to administer these tests to veterans on referral from psychiatrists who wanted help in understanding their struggles and any suggestions I might make as the tester about what could be helpful to them. In my second experience, I not only learned that we did not have much authority, power, or status in the House of Medicine as psychologists. We were an ancillary profession, much like X-ray technicians, nurses, and others, and we did not have care responsibilities. I did learn, though, that if you made a good working relationship and a good friendship with one of the psychiatrists, that psychiatrist might let you spend some time alone with a patient. You could talk to them about whatever you want. You could try to have a conversation with them. If anything interesting came up, the psychiatrist would put it in the case notes, and you could sneak into something like maybe some kind of care responsibilities if you manage your relationships with the psychiatrist strategically. This is not direct care responsibility, but one of the people on the law board to which I was assigned was a university professor. He was a distinguished professor of history. He was only about 50 years old, and yet here he was, probably going to be a resident in the VA for the rest of his life. He had early onset Alzheimer's, and in all my life experience until then, in my personal family, in the families of the friends that I knew, the people I grew up with, anywhere, even the VA in Dearborn, I had not yet seen somebody with early onset Alzheimer's, and it was heartbreaking. I knew he was a prize-winning professor. He had many awards, and he was quite distinguished, and he had only a few sentences he could utter. He would look outside and he would turn to whoever was there and say, "It's a gloomy, gloomy, gloomy day, but it'll lighten up nicely later." That was one of the things he could keep saying over and over again repetitively. Another one was if he had a cup of coffee in his hand and somebody would pass by, he would hold it up and say, "Tasty cup of Java mocha." And that was repetitive like a broken record over and over. And the third thing was if there was some kind of interpersonal turbulence going on in the day room, if two inmates were quarreling loudly or the staff was upset about something, he would shake his head and say, "No more morals than a chickadee." That was another thing he uttered. And I found what he was doing quite touching and fetching in some way. And I was heartbroken every time I would see him. And I started hoping I would never wind up with his fate. It seemed so horrible to me. His health was excellent. He probably was going to go on like that for at least another 20 or 30 years. And with that, and maybe he would deteriorate even more as the disease ran its course. So meeting him affected me profoundly. Then that ward was also unusual because it had a whole room that was set aside for a female inmate. Now, there weren't many in the aftermath of World War II. Most of the veterans who wound up in the VA, of course, were males, but this was a woman who had been a nurse, and they couldn't just put her in a dorm room with the other males. They had to create a special room for her and designate a restroom for her to use too. She was what is diagnosed as a hysterical paralysis case. And she was, there's another term for it that I'm forgetting right now. Trainees and residents were often taken into a room to see her. She sat absolutely still and absolutely mute. She would not move or did not move. I think the psychiatrist would say she could not move. I never knew whether she could move or not move. And she had what's called in the literature of hysteria, waxy flexibility. What that means is she's like a dummy. And if you took her arm and just lifted it up somewhere, and you walked away, the arm would just stay there. She was moldable by you, but she would take whatever space and shape she had put into. As the year went by, December was coming up, and I was telling one of the residents I had made a friendship with, I'd really like to spend some time alone, seeing if I could make some kind of therapeutic contact with somebody here. And he said, "You want to see her?" That felt overwhelming to me. What was I going to do if I went to see her? She even had a feeding tube in her because she wouldn't eat by herself. They had to pour food down the tube into her stomach. So I'm a psychologist. I'm supposed to be learning something. So I decided, all right, this is what's offered to me. I'll take the challenge and go see what's possible. So I came in the first day and sat down. And I said, I am here 2 days a week. I'm a psychology trainee. I talked to her as if she could understand me. I had no way of knowing if she could understand me or not. They even had to lubricate her eyes because she was barely blinking them. She didn't make any sign that she heard me. I said I'd be coming to visit her for 50 minutes twice a week when I was there. And I would see if I could be of any help to her. Obviously, she was in great difficulty. And I would see if I could make any kind of difference. So I would come and I would sit and I would say, it would be wonderful if you could say something to me. I'm not expecting it, but I would certainly cherish the opportunity to have a conversation with you. She didn't say a word. So I decided that I needed to try to entertain her. I should not ask her to do what she was either unable or unwilling to do, but I would see what I could nourish her with. So I would pick up things. I pick up things from the newspaper and say, you know, the most terrible thing happened in downtown Ann Arbor yesterday. And I would tell her about it. Or I would look out the window and say, oh, maybe we're going to have a white Christmas this Christmas. It looks like they're getting ready to bring a Christmas tree in here. I hope you'll like looking at it, even if you don't participate in any of the celebrations. So I would always find some gossipy things to talk to her about. And the weeks went by and she didn't respond and nothing was any different. She still was eating from the feeding tube and they were still moving her around. And I had made a commitment and I was going to keep it. So I continued week after week after week. It was getting on towards springtime. And I think it was in May, I said to her, well, I'm only going to be here through June, so I'm probably going to see you maybe 8 more times before I say goodbye. And thank you for providing me this experience. Just being with you has been special for me. If for no other reason that I have quiet time to reflect about my thoughts, I've shared current events with you, I've shared weather forecasts with you. If I heard something interesting in one of my classes, I talked to you about that. If there was some gossip about something that was happening on the ward that maybe I thought you'd be interested in hearing, I would bring that to you. So I'm going to miss this opportunity to keep building a connection with you. And I'm sorry I have to leave, but I assume somebody will replace me at the end of the summer. If you're still here, and at the end of the summer when the new crop comes, maybe you'll get somebody else who will come and spend time with you too. And I saw her eyes twitch a little bit. And I said, oh, you're blinking your eyes. I guess you heard me. She blinked her eyes some more. I said, good. I haven't just been saying things to myself. I'm glad you've been listening all this time. And maybe we can talk one day before I leave. And off I went. Came back the next time. And she seemed to be struggling to whisper something. So I said, are you trying to talk to me? And she nodded her head a little bit, yes. And I said, okay, let me pull my chair closer. I want to hear, if you can only whisper, even whispering would be glorious. If you can whisper something, I would be delighted to hear whatever you whisper. So I heard her whisper finally, I can't move. And I said, well, I don't exactly know what that means. I can't move, because you haven't been moving. They have to keep turning you and doing things with you so you don't get bed sores. But are you saying you're not able to move, or you don't dare to move? Is it number one? Blink your eyes if it's number one, or blink your eyes if it's number two. And she blinked her eyes for number two. There would be terrible consequences if she started moving. And I said, I'm certainly curious now. I understand you don't want to cause terrible consequences. Let me try again. Would there be terrible consequences for just you, or terrible consequences for many people? And she blinked twice. There would be terrible consequences for many people. And I said, oh, I can't go much further with eye blinking. Is there any way you could tell me anything about what the terrible consequences would be for everybody? And she sat still for a minute, and then she started whispering again. And here's what she said. The hairs are going up on the back of my neck again, remembering her saying this to me and the words she said. The words she said were, the universe is made of tissue paper. And if I move anything, I will tear a hole in the tissue paper of the universe, and all of us will be swept into the void. And I said, that was really something. I said to her, I feel so sad. You are worse than Atlas. You're carrying not only the earth on your back, but the welfare of the whole universe is in your being able to remain still. You will wreak havoc on the whole world and destroy all life, all the stars, all the planets, everything if you move. What a terrible burden you're carrying. I wish I could take some of it off of you. And those were the last words she said to me. I kept coming back, but she wouldn't talk anymore. And the day that I left her, I saw a tear roll down her cheek as I said goodbye to her and walked away. And I am telling you, those images are indelibly imprinted in me. That's one of the most powerful experiences I've had with any client. And I feel a little tearful now. I feel like I both helped her and then I failed her. She was not all alone like she had been because I was there. And she was able to talk a little and make some human connection with somebody other than herself. But I failed her. I didn't ameliorate her plight. I didn't get her to set her burden down in any way. I didn't get her to believe that she was not that powerful, that she wasn't the center of the universe, and that she wasn't going to destroy it if she moved. So I failed. At the same time, I had a small success. And I walked away from that internship feeling bad. The next experience I had was in the third year of residency. And I was now assigned to begin to get some experience with children and with families and couples. I went to the Merrill Palmer School in Detroit. One of the services was a child treatment service, and it was available to the students. These were usually exceptionally bright students who went to that school. But they had a counseling center, and the services of the counseling center was open to the community as well as to the population that was there. There was a child service, a child therapy service, and there was a couple service. And I spent time on both. I began to experiment with couples therapy, and my supervisor was an ordained minister who had become a specialist in couples counseling. So much of his work was tinged with his belief in Jesus, which was a problem for a Jewish student like me. I don't know what I was learning about couples counseling from his theoretical orientation. And the child therapy service was run by a fellow psychologist, maybe, let's see, I was about 24 at that time. He was probably about 29 or 30. His name was Clark Moustakis. He turned out to be a pioneering member of the building of the existential humanistic school in psychology. He had been trained by Carl Rogers in client-centered therapy, and he did child therapy from an entirely different frame of reference and point of view than I had ever heard about. I had learned how Anna Freud had learned to take psychoanalytic principles and translate them into play therapy in the playroom and work psychoanalytically with little ones. And here I was with a guy who didn't do any of that. So he annoyed the crap out of me because I had been indoctrinated in psychoanalytic thought and I knew the correct way to do child analysis. And what was he doing? He was doing Rogerian work. He would see somebody struggling with something and saying, oh, you're experiencing that as being very hard. He would just simply keep reflecting what the kids seemed to be experiencing and doing in a very steadfast Rogerian way. At one point, oh, we watched him through a one-way vision screen too in the playroom. So he was showing us with his own behavior what he would like us to do with the kids. And I was sitting there behind the one-way vision screen cursing at him. This is a wasted internship. What the hell is he doing? He doesn't ask the kid if they're having any dreams. He doesn't interpret the kind of toys they're playing with. He doesn't see the aggression when they crash the two cars together. There are many interpretations he should be making, and he doesn't do anything. He just sits there lazily and tells them what he thinks they might be experiencing, what they're feeling, or what they may be thinking about. And it's like he's loving them. I can see how loving he feels, and he's pouring love into them, and that's supposed to fix them. They're broken. They need psychoanalytic work, and his loving them is not going to get anywhere. And I said, I wish this internship would end. If that weren't bad enough, we had a seminar with him each week. Did we talk about cases or the management of cases? No. He assigned the literature of the existential movement to us. We read Sartre's books. We read Kierkegaard's books. We read Camus. We just read books, classical books written by existential philosophers. And that's what we discussed in the seminar. And I, again, was so angry. I would go out of there and say, what a fucking waste of time. We're not learning anything. Why should I look at this shit? It's not what I want to learn. I know what I need to learn. And this is certainly a wasted year in this damn place. Well, but a small seed was planted. Here was somebody doing something and doing it as thoughtfully as he could that was very different than what I had been trained to do. And to avoid cognitive dissonance, I was just wiping him out and denigrating him, not wanting to be influenced by him, made my life simpler. I wanted to become a master at psychoanalytic thought and its applications to all ages, to children, to adolescents, to adults, to elderly people. That was my hope for my future, and that's the career I wanted to build. I was even thinking in that year, with my miserable experience with him, that I might want to apply to a psychoanalytic institute after I finished my training and go off to the Institute for Advanced Training and become a psychoanalyst. Since I did not like being in the house of psychiatry, however, I was ambivalent about even thinking about that because psychologists were not terribly welcome in analytic training institutes. They wanted people who had been trained as psychiatrists. It was a medical institute. And occasional psychologists could come if you would sign a contract that you would be using the training you got only for research purposes, and that you would not attempt to see any people in analysis therapeutically. You would have to sign such a contract. And I didn't want to go off and be a second-class citizen again in yet another house after I'd gotten out of graduate school. So on the balance, I stopped the desire to be a psychoanalyst, a formally trained psychoanalyst from an institute with a diploma from the institute. I would make my way as a psychoanalytically trained psychologist, for better or worse. I want to report that about 5 years after graduate school, I'll fast forward to a time 5 years after graduate school. I was at an American Psychological Association convention, and I'm walking down the hall of one of the meeting hotels, and who comes by me but Clark Moustakas? And I stopped him and said, Clark, it's really nice to see you. It's been 7 years now since I had your seminar and was trained by you. And I want to apologize to you. I am sure I was a pain in the ass when you had me as a student. I'm sure you could see my discomfiture. I was sure you could see my scowls. I was sure you could hear some sarcastic comments I would make every once in a while. You put up with me. You didn't call me on it. You tried as best you can to open me to a world I was not ready to visit. And I am ashamed of myself. I want you to know my life has moved on, and many of the things I thought I was paying no attention to have stuck with me. And much of the literature you exposed me to now begins to enter my writing when I'm writing articles about something or another. So thank you for the gift that you gave to me, and I can appreciate it much better now than at the time you gave me the gift. And I felt a little bit better, like I had atoned for something that I had done that was quite evil. And I thought I was doing just such goodness in rejecting him. I moved on the next year to have my first of 2 years of internship at the psychology clinic on the campus of the University of Michigan. And it was a really wonderful place to be. The clinic specialized in working with bright students, graduate students, faculty members, and their families. We had a wonderfully bright, insightful, hardworking, and analysis clientele. Freud himself said that psychoanalysis as a technique for doing therapeutic work is probably applicable to only a small portion of the population, and to use his language, in order to be applied to the masses, the gold of the psychoanalytic technique needed to be alloyed with base metals. I think what he was referring to by base metals as it's okay to teach, it's okay to counsel, it's okay to give advice, it's okay to do other things other than just following the psychoanalytic model of treatment if you're going to work for a lot of people who just won't sit still for psychoanalytic treatment. Well, the clinic was blessed with a large clientele, most of whom wanted a psychoanalysis and was happy to participate in free associating, dream analysis, and all the other things that are part of analytic theory. I had two experiences, both with the same client. One was she was the client that I presented each week. I was picked to present her in the weekly seminar for a period of time. So every one of my visits with her was gone over in great detail. There was another client. But I was in trouble with her. I remember what I wanted to say. One day I started seeing her in April of the first year I was there. And in June, she announced to me she had summer break. She was a graduate student in librarian science. She had summer break and she was going to her home in northern Michigan for a couple weeks, and she would be interrupting her therapy for that period of time. Was I going to be in residence for the rest of the summer? I said I was. And she said she would return after her 2-week vacation. So, fine. I then heard from, we had made a date for when the appointed next session would be. I heard from the secretary receptionist downstairs where the waiting room was that she had arrived and I had expected her. And I went down the stairs from my upstairs office. And as I was going down the stairs, right behind me was one of my supervisors. He had a client waiting for him too in the waiting room. And so he saw me and followed me down. I walked up to her and said, "Welcome back." And then I made a gesture, "You can go upstairs now." And she followed me upstairs. The next day, he called me out of my office. And he said, "You can't do that." And I said, "I can't do what?" He said, "You said welcome back to her." He said, "You're contaminating the transference. You don't do things like that. You don't do social niceties with the clients we see. You must be a blank screen at every moment. When you go and greet them, you just nod your head and make a gesture for them to follow you up the stairs. You don't talk to them. You don't do anything. You have to train them to get in the chair, turn their back to you, and start free associating. You say nothing. Can't I teach you? Don't ever make that kind of breach again." Ooh, and I felt terrible. I felt ashamed. I should have known better. What the hell? I slipped. I did what my analyst did that day. I slipped out of being the analytic therapist. I actually talked to her like a human being. "Welcome back from vacation." And that was a terrible breach of what my responsibility was. So I still remember that. I don't like being scolded. I respond very badly. I suffer. I think I'm horrible. What the hell did I do? I ruined something forever. It was a bad moment in my student life. The other thing was there occasionally we did child therapy in the clinic. It wasn't our prime focus. But one day I got picked. Somebody named Billy, I won't tell you his last name, an 8-year-old had been brought in by his father. He had been referred to the psych clinic for some reason. I think he was some kind of worker at the campus of he did physical labor of some kind. He had a child and he was asking around, is there some place his child was troubled and troublesome. Was there some place to bring him? And the psych clinic was suggested. So there they wound up. And the case was assigned to me. And the presenting complaint was that the father couldn't control him. He was, the label now would be oppositional defiant disorder. I don't know what the hell we called them back then. We were only at the DSM-2 when I was in graduate school. It may even have been the DSM-1. But he was misbehaving and unruly, and the father wanted help. So I introduced myself to the kid. I took him downstairs this time to the playroom. I opened this large double-doored closet and I said, "We're going to be together. I'm going to try and get to know you today. And here are all these toys. You can play with whatever you want. There's a blackboard if you want to draw pictures. There's an easel and paint. You can do whatever you want in here." And very energetically started to go through the closet, throw this aside, that aside, pick through that. He was looking for what it was that he was going to settle with. We had been there for about 5 minutes, 6 minutes, and then I got a knock at the door, and the secretary said, "I'm sorry to interrupt you, but your wife is calling and there's an emergency." So I had not been prepared properly. I never had a course in child therapy. As part of my curriculum, I didn't. I was going to have experiences in child therapy, but the university left it to my supervisors in those experiences to teach us the handling of various things. I didn't know what to do with him. So I just said to him, "I'm going to be gone for a few minutes. You can go ahead, pick your toys. You'll be safe in here. And you can go upstairs." Up the stairs we came down, the receptionist is there. "I think your father may still be there. If you get uncomfortable here, just go back up the stairs." So I went and I was gone much longer than I thought I would. My first wife, was again having a hysterical hypochondriacal attack. She was convinced that she had cancer. I had to leave my internship. I had to go get her and drive her over to the emergency room at the University of Michigan because she was sure they would see it immediately and she would have to be checked into the hospital and they would have have to start cancer treatments. And I tried as patiently as I could to say, we've been through this several times already. You're only having a panic. Take some deep breaths. I'll be home in another 2 hours. I'll look at it. Maybe we'll go, maybe we won't have to go, but I really am in the middle of a session. I need to get back to my session. And she kept persisting and persisting, and I decided there was no way that this was going to stop. She was going to just keep calling the secretary, and she was going to scream and cry and carry on, and I better interrupt the session. So I went back down, and Billy was still there, and I said, I'm sorry, there's something come up. We can't meet with each other today. Your father is still upstairs, and let me take you back to him and we'll see if we can make another appointment. So I reported to the secretary what had happened and that I had to leave. My wife was in a bad state and I needed to be there to figure out what to do with her. And I returned Billy to his father and I apologized and said, there's an emergency at home. I'm going to have to leave today and perhaps we'll make another appointment. I'll call you and see what we can figure out together. And I got his phone number. Off I went and I calmed my wife down finally. I didn't take her to the emergency room. I went back to the clinic and the secretary said, I went to tidy up the playroom because you had left and there was a terrible stench in here and I found a bowel movement in the wastebasket. I said, what? She said, I found a bowel movement in the wastebasket. I guess the little boy relieved himself in the wastebasket. And then that was the topic of conversation at the next staff meeting. What was the meaning of his doing this in the wastebasket? And we dealt with this, of course, psychoanalytically. We started talking about anal sadism. We started to talk about how vicious he was. And we understood his father's problem because he was unsocialized. We speculated about what earlier life experience would have made him somebody who can't curb his aggressive and destructive impulses. We had a field day trying to speculate about his dynamics and what were the likely dynamics in the family. And I joined in. I was going to be the most erudite of the bunch. I came up with a bunch of theories that I don't remember right now to try and explain his unsocialized, uncivilized behavior. And I want to tell you, 3 days ago, when I remembered him and thought I should talk about him, I felt ashamed of myself. I think I had a little boy with a tyrannical father. I think he was very frightened. I think when he started to feel the urgency to go, he got terrified. He didn't want to soil himself. He didn't have the courage to ask any adult to help him. He thought he would get into trouble, and he didn't know what to do to take care of himself. And he made the best compromise possible. He at least relieved himself in the wastebasket rather than soiling himself or leaving the playroom. He was very dutiful and stayed where he had been told to stay. I feel so sad that I failed him, that I didn't understand his behavior, that I was unkind to him. The whole staff was unkind to him. We labeled him as some kind of tyrannical, disturbed person when there was a whole alternative explanation that now in retrospect makes even more sense for me since I had experienced him directly. And I'm appalled at myself. But I think that takes care of the memorable experiences that have stuck with me over the years. I think I'll take a breath and move on because I'm getting ready to leave Ann Arbor and to become a psychologist. Oh, you know what was wonderful? There was no psychology licensing law when I left Ann Arbor to become a psychologist. The state had finally given something to the profession. It started some small piece of recognition that there was to be a profession called psychologist. We could register and we could call ourselves registered psychologists. And there were standards. In order to be a registered psychologist, you had to have a PhD in psychology from an accredited institution of higher learning. That was all you needed to become a registered psychologist. And it was a relief to become a registered psychologist because that back then, if you wanted to find a psychologist, you went to the yellow pages. You may have, some of you are old enough to remember yellow pages, the phone directories, which were very thick, huge, heavy things you carried around. The back part of them was yellow pages. These were commercial listings, and you could find various trades, stores, everything under the right heading in the yellow pages. And the yellow pages heading for where psychologists were was spiritualists, fortune tellers, and psychologists. We were lumped together with spiritualists, fortune tellers. Once we became registered psychologists, we now started having our own listings in the yellow pages. We weren't lumped together with the other people anymore. And so even before I left Ann Arbor, I was able to write a board of psychology had been created, and there was a state process by which you sent your credentials in and you could get your registration certificate. Before I even left Ann Arbor, I was already a registered California psychologist. Very proud of it. And when the licensing law came a few years later, all of us who had gotten registered were grandparented in. I never had to take the licensing exam. I dodged the bullet. One of my greatest accomplishments. So why was I coming back to California? Well, I had struggled. I had detested Ann Arbor the first year. I only disliked it the second year. The third year, I started to find Ann Arbor tolerable. The fourth year I was there, I began to enjoy parts of it. The fifth year, I actually considered staying. I think I said last time, I'd been made a very, very nice offer by the university, and I could have stayed, but it was not an offer of going into independent practice. And I still wanted to come back to Southern California and go into independent practice. But I had another horrible experience just before leaving. And fortunately, it was not characteristic of the program in which I was enrolled, but it was characteristic of 80% of the programs my poor fellow graduate students around the nation were enrolled in. I had a last summer seminar that ended August 1st, and I was leaving for Southern California about August 20th. So that seminar was a seminar in social issues and ethics, taught by one of the great elder statespeople in our field. I mentioned his name before. E. Lowell Kelly taught the seminar. He was with the CIA, what was the OSS that was the CIA during World War II. He was getting on in years. He was going to retire in a few more years. He was also the founder of the Division of Clinical Psychology in the American Psychological Association. Much respected and much revered. I liked the seminar. He was talking about possible future past, possible challenges. APA had just finally done its first code of ethics, and he went over it in detail, and we talked about the rationales for it and what the meaning of the code of ethics was. And he was very nice. We met at his house on summer evenings, and he always gave us dessert and some brandy after dinner. We were treated sort of like colleagues while we had our discussions. There were 8 of us in the seminar. Very nice, very comfortable. Towards the end of the semester, he said, your time with me and your time here is almost over. I think 6 of the 8 of you are just about ready to file your dissertations, and that's the last thing you have to do before you leave here. Do you know where you're headed for yet? And people started popping up. I'm going to go be the chief psychologist at such and such a hospital. I am going to go be a faculty member at such and such an institution. I'm being hired in somebody's clinical research project at this place, other place. He got around to me and I said, I'm going to join a group practice in the San Fernando Valley section of Los Angeles. 3 PhDs who got their degrees a few years before I did opened a center there, and they're very busy. There are lots of clients coming in, and they need to add staff. So they want to add me. I'm going to work with adults. and they added from somebody that just graduated from the child social work program at USC, and they're adding him too so that they can have greater access to working with children. He said, "You're going to do what?" And I said, "I'm going to join a group practice and go into independent group practice in the San Fernando Valley of the Los Angeles basin." He said, "You're going to throw away the education we gave you?" I said, "Well, what do you mean throw away the education you gave me? I'm going to use the education you gave me." He said, "No, you're not. You are about to undertake an unethical career." I said, "An unethical career? Well, what's unethical about the career?" He said, "We do not know enough to offer services to the public. It's going to take another 100 years of sensible research before we'll have the real tools that we have a bunch of people parading around as if they had valid tools, but they're charlatans." He said, "You're going to join the charlatans. The tools you're taking away, even the best ones we could give you, are not sufficiently tested in the laboratory. There haven't been double-blind studies about their outcomes. This is a 100-year project. Now get your ass into gear and go participate in making it happen." He said, "I got two places I could park you in. The Salvation Army is about to undertake something I find very exciting. They've never done this before. They're going to take on being a place that people with addictive problems, alcoholics and people with drug addictions, can come for care. And they're going to try, under the aegis of the Salvation Army, to set up care centers at every one of their Salvation Army locations. And they don't know how to design this. They need psychological help, not only in designing it, but in doing research on its efficacy, whatever gets designed. And I can get you a job as the chief psychologist of this program, and you can start a whole bunch of research. You can get research assistance, you can get research grants. The Salvation Army will give you a lot of money, and if you want to teach here, I know it's a commute, but we'll let you teach a course here. You can come as an adjunct prof if you like teaching, but God damn it, take that up. Or I have a wonderful position at the Yale Child Study program. There are several programmatic research projects going on there. They're studying autism, for instance, and I can attach you to a wonderful research project at Yale. That'll be a terrific thing to have on your resume. And I said, "No, thanks. I am going." I kept repeating the same words over and over again. I said, "I'm sorry. Thank you for your passion. I respect what you believe in and stand for. I do not share your values or beliefs." That is the town and gown problem that goes on. The people who are the academic and research people in any discipline have contempt for the practitioners. They think the practitioners are sold out and all they're interested in is money. And if they were true to anything pure and good, doing research is pure and good, and teaching is pure and good. But practicing is corrupted with crony capitalism, and it is a vile activity, and that's their values. And I am telling you, 80% of all the graduate students in the country while I was in graduate school were subjected to the same kind of indoctrination. They would have a course in the Rorschach test, and the first thing that would be taught by the professor who was supposed to teach them the Rorschach test so they could use it in their VA internships, they would be taught that any studies that have been done so far to demonstrate any validity to the findings of Rorschach testing somebody have failed to show up anything of significance, and the Rorschach is not a usable instrument at this time, and the kinds of claims that are made for it should be taken with a grain of salt. And he would say, we know that you have to do that crap when you go to the VA, because the VA psychologists and psychiatrists require you to do the mumbo and jumbo, but don't you ever fall into the trap of believing what you're doing has any validity, because there's no demonstrated validity whatsoever. And the same thing would happen when they would take psychotherapy technique classes. This is the state of art right now. It's totally unprovable and unfindable. And other people are going to come and start suggesting we do different things with patients. And there won't be any validity for that in the beginning either. And they would sound the same thing that Elo Kelly was sounding. So people had to lie. Most people in graduate school had to say they weren't interested in practice, They were not going to go into practice. And of course, what they wanted to learn to do is what kind of programmatic research they should start when they get an academic position after they get out. Most of the coursework was being taught by people who did not believe that what they were being called upon to teach had much merit. Most of the departments around the country were taking the federal dollars to do the training, and they liked it because they could hire more faculty, they could get more laboratory space, they could hire more facilities, they could hire more research assistants, but they had no belief in the prime mission that they were being told to teach. It was heartbreaking. And we had to lie, cheat, and hide ourselves from announcing anything about our career aspirations. Not a good system. It was a very broken and dysfunctional system. At any rate, how did I get found? Well, the American Psychological Association has a publication called The Monitor. It's currently a magazine with all kinds of articles in it, as well as a thing that has some classifieds in it. It's mainly articles. But back then, it was nothing but interesting classified ads, mostly about classified ads for faculty positions around the country. But every once in a while, there was an ad for some applied position of some kind. And that's where I saw what the three psychologists had. They called themselves the Western Psychological Center. They were located in Sherman Oaks. And they said that they were growing and they had a big waiting list and they wanted to be responsive to the needs of the community. And they were seeking to add a young psychologist of promise. And they would pay his full salary for 2 years while he was building up his practice. And then after that, if he chose, he could enter into negotiations to become a full partner after the first 2 years of his learning on the job and building up his own practice. That sounded absolutely fine and straightforward to me. Oh, they said they will fly somebody to be evaluated by them at their expense, and they'll put him up if he or she needs lodgings, and they'll feed him and whatever else needs to happen. So I had applied, and in July, they brought me to Southern California, and they evaluated me, and they seemed to like me. And they said they're going to do due diligence. They had at least 4 more people that they wanted to have contact with and evaluate before they made a final decision. They hoped that I would give them some time. Might take 2 or 3 more weeks, and they would get back to me. So I went back hopeful, but with nothing real. And then 2 days later, my mother called me. She said, "You have a telephone interview." I said, "I have what?" She said, "Well, I have a friend who knows a psychiatrist at UCLA, and the Department of Psychiatry is opening a whole new branch. It's going to be called the Neuropsychiatric Institute. And it's going to be it's going to have its own building, and it's going to be devoted to working with psychiatric patients. And they need to increase staff markedly. And they picked a chief psychologist to be responsible for recruiting psychologists to come to the staff. They're going to need several. And my contact, my friend, gave me his name, and I got in touch with him, and I told him what a smart son I have and about how you're graduating from the University of Michigan. And as a favor to so-and-so, would you be willing to interview him? And I got furious. I screamed at her, "What the hell are you meddling in my life? I'm quite capable of finding myself a job. Yes, I'm trying to get back to Southern California. I have a wonderful job offer here at the University of Michigan. I might decide not to come at all. You know, if you're again going to be intrusive and meddle in my life, I think I'm going to take the job offer from the University of Michigan and forget about moving close to you, because you're going to make my life a nightmare if I do that," I said to her. Talk about oppositional defiant disorder. And then I calmed down afterwards and I said, "You know what? You may be throwing away a good opportunity." Just because you're mad at your mother and this thing fell in your lap in a way you don't approve of, maybe you should at least explore it before saying no. So I got back in touch with the guy who was trying to get in touch with me, and I said, okay, let's have a phone interview when, and the next day we did. He talked to me for 2 hours about dreams for the future of the Neuropsychiatry Institute, what kind of people, what kind of training he wanted to hire. And at the end of the conversation, he said, I've already talked to 6 people, and you're the best of the lot so far. Since I need so many, I want to start with you. I'm offering you the job. Will you take it? And the terms were good. It paid well. I could do some adjunct teaching in the psychology department if I wanted to. As part of my contract, he would work that out for me too. I could supervise graduate students. It seemed like a really lovely package. So I grit my teeth and I said, yes, I'll take it. I didn't know what the guys in the group practice were going to do. I had to wait for them. And I wanted something that was certain. So there was something certain, and I said yes. And here is more shame. I'm not proud of myself. I was taking care of myself. 4 days later, the guys in the group practice said they wanted me. And I gulped because I far preferred doing that than going back into the house of psychiatry. I might have enjoyed myself as a psychologist in some ways, but I think I, again, would have found it very, very oppressive. And it might have paid well and all the rest, but I didn't want to be a handmaiden in the House of Psychiatry. So I called Alex Rosen back and I apologized. And I said, I am ashamed of myself. I said, yes, I would take the position, and I'm now reneging on my offer. I am saying no. Something I'd rather do is come up, and I'm going to do that instead. He was very hurt and very angry with me. Years went by, and we would see each other, bump into each other at meetings or conventions of one sort, and he would still glare at me like I had been unethical and I had done a terrible thing. Well, I agree with him. I did a pretty terrible thing. I comfort myself that I was not molesting any children, and I was not murdering anybody on a big list of what's terrible. This was not at the very top. It wasn't at the very bottom either. But I've been living with myself and my guilt all the years since then. I should not have done that. I should have had more integrity. But there I was, getting ready to go off. And then in April, I decided that I was going to come by Los Angeles to look at scope housing and everything else. And I wanted to renew my acquaintance with people I had known. So the Western Psychological Association convention was in Monterey that year. I thought I would do a triangle trip. I would fly down to Los Angeles, see my new colleagues, make some more concrete plans for when they wanted me to show up, and work out some details. I'd see my family, and then I would fly up to Monterey, and I would see who I could see that I had known from my previous life before I had left the Southern California area 5 years earlier. To my wonder, what I ran into was James F.T. Bugenthal. He was sitting in the coffee shop at a table with what was now his colleague, Alvin Lasco, who also had been a faculty member at UCLA. The two of them had finally left the university in those 5 years, and they themselves had a group practice with a couple other people in Westwood, near the UCLA University. And he said, "Oh, Arthur." I said, "Yeah, I'm here. I'm getting ready to return to California." He said, "Do you have a job? We're looking for staff." And I said, "Oh my." I said, "I hate to say this to you. Yes, I do have a job. I hate disappointing you. I would love to work for you, but there's this disconnect with us now. I am very devoted to psychoanalytic theory. And I knew you're still in your existentialist humanistic perspectives and moving on. I've seen some things you've published in the meantime. And I don't know if you would put up with a ironclad psychoanalyst on your staff." I said, "But I have a colleague at the University of Michigan who's also getting his degree and is going to be free at the end of this month. His name is Tom Greening, and I think he might fit in well with you. Want to have a telephone interview with him? I will highly recommend him. I think he would be perfect your practice and for what you're wanting. And he is already, he knows the existential literature. He did a Fulbright abroad, and one of the things he was studying in his Fulbright was the history of existentialism. So I think he would fit in very nicely. And I'll be happy to tell him he's still looking for a position right now, even though he's getting his degree. So they had a phone interview and they hired Tom. And now I had a wonderful experience at him. We were going to caravan and drive across the country, him in his car and his and mine. And since I've worked in car shops when I was a teenager in my first year of college, I knew what to do. I wired a little yellow light of the kind that's on the side of trucks up on the hood of my car, and I put another one on the back bumper. And I put the same thing on his car and his hood and his back bumper, so we could see each other at night, not lose each other. We could keep track of each other on the highway, even after it got dark, because those lights would go on when the headlights were turned on. And we would caravan. We would stay together. We would find motels at night and room together and have dinners together. And we would have a lovely, lovely trip across the country. He didn't know a secret, and I didn't tell it to anybody. The secret was I was in love with his wife. So I was very glad that they were coming to California. He had gotten married in the second year of graduate school. And Jewel was beautiful, and she had gone to social work school. She was a social worker. She was very bright, and I thought she was very sweet. Turned out he got a divorce soon after we got to California. But at least on the surface, I was lusting after her from a distance. And of course, I didn't grumble or complain to my classmates about what I was going through with my wife. I was ashamed that I was with that wife and not talking about it, except to my analyst who didn't seem interested. So I thought Jewel would be around, and just her presence, maybe one day I would have an affair with her, maybe my marriage would break up, maybe his marriage would break up. So I was full of mystical daydreams about Jewel, the beautiful one. So I was happy they were coming to California where I'd be able to see her frequently. And off we went, and I settled into my new life. My new life jarred everything very quickly. And now I'm back to talking about clients. I learned that being in a group practice where you are the newbie is not any different than being in any kind of agency. That is, new clients come in and the senior staff, the senior people skim off all the ones who are easy and interesting to work with, and the impossible ones are left for the newbies to try to contend with. And I was back in that kind of landscape again. So one of my earliest assignees was the following. A middle-aged woman had called in kind of an urgent panic. Her daughter was living with her. Her daughter had had to move in with her, and their relationship was terrible. And the daughter was really in bad shape psychologically, and her daughter needed to be seen as fast as possible. And when that came in, when it came in on the day that we did rounds and tried to make assignments, I was asked immediately, do you have any free time today or tomorrow to get involved with this referral? And I said, yeah, 4 o'clock this afternoon, I'm free. She said, all right, call the mother, here's the phone number, and see if you can work out something for 4 o'clock this afternoon. I called the mother, and the mother was very grateful to hear from me and said, all right, I will be there with my daughter at 4 o'clock this afternoon. I forgot to ask her how old her daughter was or anything about her daughter or what the problem was. I decided I'd wait until I could interview the daughter herself. I didn't want, here we go again, I didn't want to be contaminated with the mother's thoughts about the daughter. I was going to do a psychoanalytic first interview with the daughter when I saw her. So I opened my, I was buzzed by the secretary receptionist that my new clients were there, and I opened the door to the waiting room, and there was a middle-aged woman looking harried and harassed and just troubled as hell. And there was a young woman still in her pajamas at 4 o'clock in the afternoon, around, I would guess, 21, 22 years of age, slumped practically semi-conscious up against her mother and snoring while she was there. And I said, well, let me invite your daughter to come in so I can have a conversation with her. And she said she's passed out. She shot up some heroin before, and she's had a half of a fifth of vodka, and this is what she's like all day. She has a daughter she had out of wedlock, and she brought her home, and I have to take care of the daughter, and I have a small apartment, and she's like this all the time. I can't control her, and we have only one small bed to sleep in at night, and she wets the bed at night, and I have to get up in the middle of the night and change the bed, and I'm left taking care of her crying baby. She won't nurse it, and I don't know what to do. I'm beyond myself. This is my first case. I was supposed to get my psychoanalytic techniques and do some interpretations and ask if anybody has dreams to tell me about. I could see that I'm bankrupt. I didn't know what to do. I was in a panic. I got this horrible dilemma sitting there in front of me in my waiting room. I don't know who to bring in. I don't know if anybody should come in. I don't know what I'm going to do if I invite them in. If I take any responsibility for that, what am I supposed to do? And I said, excuse me for a moment, I have to check on something. And I went out and I asked the secretary, do we have any kind of directory of community resources around here? And she said, yes. And I looked that there was a hotline for drug abuse problems. So I went back out and I said to the mother, I am sorry. This is not a good referral place for you. The kind of, your daughter is not up for the kind of work we do. But here's a drug abuse hotline resource. Please, when you leave and go home, call them and tell them what the problem is and see if you can get a referral for people who are better qualified to work with you and your daughter than I am. And I sent them away. And I felt terrible. I remembered Freud's quotes about the base metals, the gold of psychoanalysis needed to be alloyed with the pure gold, pure base metals of something else. And I didn't have the something else. I knew of something else to do for them, except refer them out. And was I going to limit myself to the 10% of the population in doing my work that was willing to endure and put up with psychoanalytic rituals when I myself had found them so suffocating? I needed to rethink my commitment to my orientation. That was really a hard conclusion to come to. And if I wasn't going to pursue my own orientation, what the hell was I going to do? I felt lost. I felt lost on the precipice of now having a significant number of my clients assigned to me, and me having no template I suddenly could believe in that would tell me how to talk to them or what to talk to them about or what the limits of my talking to them should be. Nothing made sense suddenly. That experience in the waiting room bankrupted my world. It stopped the world. It was like a Zen koan that had been handed to me. I couldn't go on thinking in the ways I've been thinking so strongly. All right, it seems to be about time for me to stop now. So my usual two attendees, who are in some ways my producers, are here, and I will turn it over then to Dr. Scott Harris and to Dr. Aaron.
Arthur, in regard to your one of the first patients that you talked about, who was mute and still, what did she actually teach you, and how have you utilized those teachings with future clients?
Very nice. I had not an exact replica of her, but about 10 years later, I had a 15-year-old boy who came in. I was doing all kinds of bizarre behaviors. But when he came in, he sat in the chair closest to the door, and I told him everything I knew. That's one thing I do now. If I've been given information about somebody, and I'm seeing them for the first time, I don't want to keep secrets. So I'll share with them whatever the information is I already have been given about them. And one of my early questions is, do you want to amend any of this? Did I get the right story? Is it wrong in some ways? He wouldn't answer me. He didn't say anything after I told him that. Well, this is a case I may talk about later because it's really fascinating. It has many lessons in it. But I want to say that for the next 7 months, he did not utter one word to me. He not only didn't answer that question, he wouldn't talk to me. And yet, when I asked him if he would prefer leaving and just sitting in the waiting room, he would shake his head no. He wanted to keep coming, but he didn't want to talk to me. And I had the same challenge. What am I going to fill the time up with that might be meaningful when he has nothing that he's willing to share with me? And I learned I can take that chance. I might be clumsy, I might be stupid, I might be saying things with no meaning, but I'm taking responsibility to see if I can make the relationship happen when somebody else is unwilling or won't take the responsibility to make a relationship happen. I have to do the relationship building. It's called now, in current terminology, being responsible for the working alliance. I can't just wait for it to develop. I have to be actively involved in some way that has meaning for the client and seeing that we have a caring working alliance with each other. So that's my answer to your question.
Okay.
I had kind of a similar question. I was wondering if you had another year with that woman who was graciously holding the universe together in a way. If you had another year, given what you know now, what would you have done?
I would have done magic to ask her to turn over some of the responsibility to me so she doesn't have to carry it herself. I would have found some magical incantation or something to enter into her wonderful delusive world. Or I'd say I'd had a communication from God himself who said that she had carried the burden long enough and she can't give it up yet, but I'll take a part of it. I would have tried something like that probably. I would have wanted to go on seeing her and feeding her words and feeding her my caring and attention in exactly the same way. But I would have started to try to see if I could lift her burden too. That didn't occur to me when I was there before.
Yeah, I think we all have those cases where 10 years later, you can look back and think about with that, with that 2020 hindsight, the ways we could have been better and how we were really practicing. Yeah.
Arthur, early on, it seemed like you had a passion for private practice.
Yes.
Was that not right? And what fueled that passion for you early on?
Well, the passion at first became simply a passion to become a psychologist and help people. As I began to get experience with the various ways in which psychologists are employed, like on the staff of VA hospitals, working in mental health clinics, the only one that seemed to allow for some inventiveness, some freedom, and some autonomy was to go into independent practice. And it seemed like a reasonable model. Most other professions, lawyers aren't being supervised by some other profession, and physicians in practice don't get supervised by some other profession. They are the ones who judge and decide and intervene and facilitate in whatever ways they have learned to do so. I didn't want to give up autonomy. As you see, I had what felt like a very intrusive mother. So being able to be in control of my own destiny was very important to me.
Mm-hmm.
That's what I had to evaluate with my new partners. Were they going to dictate to me? And no, I found out the supervision was collegial. If I had trouble with my cases, they'd be glad to talk to me about what to do, and they would recommend some suggestions, but they weren't going to dictate to me anything that I was supposed to do. It's very much you and I and Aaron are in a group together. That's what we have. We have a colleagues group where we talk about where we get stuck and what we're perplexed about. And we get lots of suggestions, but nobody said the next time you go back, you're going to tell the client this. No, we don't work that way. And I don't want to be in a setting when I'm told that.
Did you have a sense at the time? I know looking back, you know that there's like this nascent part or this aspect of the burgeoning field of psychology. But when you were actually living it, did you realize that you were living kind of a unique spot in the development of the field?
Yes, absolutely. Those of us who are independent practice were in small number. We knew that this was something special. And we heard the aspirations of those in graduate school. There was going to be a tide of others who were going to come and join this movement. And that, thank you, that's a good lead in for my next topic. Not only will I talk some more about early clients and their impact on me, but I'll talk about getting swept up in the movement to expand and build the profession and to open increasing opportunities for independent practice, because that was both it was like a civil rights movement. It was full of passion and belief in the goodness of what we were doing, and that we were starting to serve the public in a meaningful way, and it should expand and it should flourish and prosper. And it was also an exercise in tremendous complex politics. And I learned a lot about both of those things, and you're anticipating, thank you for the lead in. Now, now I'm really eager to get on with this. We have to get.
Well, that'll be good for next week.
So I want to thank everybody else who's watched this episode, and I'll look forward to picking up my discourse with everyone a week from today.
Okay.
And this will be posted in the next, I don't know what, week to 10 days, I imagine.
Yep, I'll catch it all up pretty soon.
Thank you.
Okay.
All right, goodbye,
All right.
guys.
Bye.
Be well. Bye now.
Bye.